Good afternoon and welcome to this Ask the Doctors on Whitewater Community Television, WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. The program is also available on CTV3 in Connorsville. Our doctors, as usual, in their places, Dr. Thomas Huth, Vice President of Medical Affairs for Reed Health, and Dr. David Jetmore, Wayne County Health Officer, motorcycle rider, keeper of exotic pets. How are you?
I'm great, Eric. How are you doing today?
I'm doing fine, thanks. We'll give you both just a minute to kind of start. Another week has passed. We have summertime temperatures. People are out in full force. Some wearing masks, some not. Talk about where, from a Wayne County Health Department standpoint, things stand. Dr. Jetmore, let's start with you this week.
Well, things are continuing to look better and better. We had one more death reported in Wayne County by the Indiana State Board of Health, which would bring us up to 6. However, that person was living in a nursing home in Henry County for 4 years, and even though his prior address had been Wayne County, even though Indiana Department of Health counts it, I'm not counting it, Eric. So we still, the official Jetmore count is we're at 5 deaths. But the number of infections continues to increase. The number of deaths is basically held steady since May the 7th. And I think we're helped to a great degree by this warm weather. The virus in the open air is much less infected. You're much less likely to get an infective dose. I think masks are probably not necessary outside as long as people distance themselves. I encourage people to continue to wear a mask when you're inside doing shopping or going to the drugstore, going to the grocery store. But I'm much happier now than I was 6 weeks ago, and I'm sure I'm speaking for Tom as well. It's not fun being on the other side of the curve when things are increasing. It's much nicer to be on the downslope. And I just hope this continues, and all is well for the time being.
Okay. Dr. Huth?
I would echo pretty much what Dr. Jetmore said. I myself managed to get out late yesterday afternoon and played a round of golf with a buddy, and it was nice to be out in the sun. And I think I got a little bit of too much sun on my neck, but I kept thinking that that's good for, frying out those bad COVID virus bugs. And I think in particular what getting outside really does for people is that in addition to getting exposure to UV radiation, it's not all about the ultraviolet radiation sterilizing virus, which it can do in theory. But I think that helps us because it helps us to generate more vitamin D. We think of vitamin D as helping with bone and muscle support, and certainly that's its main thing. But it also is known to have an impact on immune competence. And so it's not so much that everybody should take vitamin D or everybody should get lots and lots of sun. It's just making sure that we have adequate vitamin D levels. And, most of us have been inside a lot for the last couple of months, and that carried over from the winter. So getting a little bit of sun exposure, I think, is really good for people all around. Plus, it's just good for your mental health. And then doing something physical outside helps to boost your stamina, which, should we get into a bad flu season or another upswing in COVID, that will prepare us for those times.
Okay. One of the things that we've been able to do over the past month more often than not is bring someone else into this conversation via phone. We have on the phone with us Dr. William Black, Pediatric and Internal Medicine Center is where I know him from, family physician of mine. Dr. Black, glad to have you here with us today.
Thank you, Eric. It's nice to talk to you and Tom and David. It's always good to hear your voice.
Thank you. Thank you, Bill.
This is one of those times, again, where I'm going to let the doctors talk to each other, and I'm going to step back.
Now, Bill, it's Tom Huth here. I want to let you know, just for full disclosure, that right before we went live, Dave Jetmore classified you as a classic overachiever because you are double board certified in pediatrics and internal medicine, which is quite the feat. So
Right.
we know we're talking with a certified, very smart person here.
Thank you very much.
Well, I wanted to ask you a few questions about COVID and the Peds and Internal Medicine Center, particularly from the pediatric standpoint. How has COVID affected your practice? How has that journey been? What have you seen happen over that period of time?
Yeah, for us in the office, it's been a little bit different in that we haven't been that busy. When Reed started their respiratory clinic, they saw patients from age 14 and up, and then the plan was for our office to see all the 13-year-olds and younger. And I think people didn't want to come out unless they had to, and then pediatrics is somewhat more seasonal, and this is not a busy respiratory time for us. And then when you also factored in the fact that kids got taken out of school and they weren't congregating with other kids, we just haven't been that busy from a respiratory standpoint. So it's one of those, yet another weird, unforeseen consequence of a health crisis where we just weren't that busy from a pediatric standpoint.
Hey, Bill, let me jump in here with a question. Christine Stinson, the director of the health department, specifically told me that immunizations were down 90%. I think in a large part because people were fearful of bringing their children to the doctor because of the COVID virus. Have you seen that in your practice, that immunizations are down?
No, I don't. I'd like to think no, and if they are down, I would certainly say that they're not down anywhere near that percentage. And one of the first things that we decided from a pediatric standpoint is we were going to continue to see kids for well visits and clearly for immunizations. And we felt very, very strongly about certainly the infants or the first 18 months of life, getting those people vaccinated, continuing them on their schedule, because the risk of some of those infections and the consequences are really much higher than COVID. And so we purposefully would call the families and say, we're safe here. We're not seeing anybody sick. And what we did, at least in our office, is we set time during the day where it was only for well people that were feeling fine, hadn't had any known exposure. And then we set another time of the day where we would see those that potentially were sick, and including with respiratory symptoms. But I think it's a really good point. I think both for Reed, for Wayne County, and even beyond, that we really, really encourage parents to get their kids back into the office if they haven't, and or stay on that immunization schedule, because that's just critically important.
Well, Bill, you referred a moment ago to the fact, in your view, that not taking care of the normal healthcare needs is actually more of a danger issue for children than is COVID-19. So what is your impression of the risk of COVID-19 with children? Are they at higher risk, lower risk? Have you seen any of the severe consequences of COVID that are described, like the multi-system inflammatory syndrome kind of thing? Or what is your impression of the risk factor for children?
Yeah, and I'll go with what is known nationally, but the risk is much lower for children in general than adults. And we haven't seen, we're not sure how much we've seen here, because as you guys know, we couldn't really test anybody for a while unless they were really sick, and if they were really that sick, there were a couple of children at Reed that did get tested and they were negative. But so we haven't done a whole lot of pediatric testing. The overall risk, national risk, is very, very small. You know, you hear about some of these horror stories, the inflammatory response, but those are really rare compared to the adult and the adult problems and consequences. I'm not trying to minimize anybody getting COVID, but and I'm really thankful that it hasn't hit the pediatric population, because that would be even much more worse of a story. But overall, Tom, I'd say the risk for a kid getting significantly sick, any child really, is still very small.
So you mentioned that earlier that you have created a very safe environment in your office for people to come in and be seen. What are some of the things that you're doing in your practice to ensure safety?
Well, every patient is screened by the telephone. There's a number of questions, and this is true for all Reed practices. Do you have known exposure? Do you have fever? Do you have any respiratory symptoms? So that happens to everybody. And when people call in, and we do that routinely even if you're scheduled, if you have fever, cough, any type of respiratory symptom, then we have, what we're doing currently is slotting you towards the end of the day, where we can get you in and not expose you to any other person, especially a healthy person. So we're still seeing healthy adults. We're still seeing healthy children in our office. You know, after every visit, the room is scrubbed down. The waiting room is cleansed numerous times during the day. I would argue that our office is probably safer than the Kroger's or the CVS, just because of all the precautions that we take.
Well, Bill, we really appreciate you being on the phone with us today. Going to let you get back to work. I imposed on Dr. Black to make time for us, but he was very nice about obliging, but he's got a busy afternoon left to go. So, Bill, thanks so much for talking with us.
Thanks, Bill.
Thanks for the time,
Welcome.
Dr. Black.
All three of you have a great weekend.
Thank you.
Bye-bye.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. One of the things we didn't ask him, and we have been asked, you all have been asked actually over the last couple of weeks, and we already have a question, what's going on with the schools? Not something I know that you all can answer, and even Dr. Black couldn't have answered. I think if I could take a second, I know that the state released some of their recommendations today. I'm not sure whether either of you have had a chance to kind of take a look at those. They're leaving a lot of things to the local school systems. They have laid out some of their recommendations, but they aren't requiring anything, so they'll leave it to the local school systems to kind of take the shots, take the heat, whatever the case may be. But some of the things, maybe closing some playgrounds. I think they maybe recommend students and teachers being in masks. I don't know if you all want to weigh in on that. And I know maybe one of the things that we've talked about is reaching out to a couple of the superintendents and having them in a couple of weeks, particularly after some of the school boards have had a chance to meet and kind of make some decisions, come in, be part of this program, and talk about that. But if there's anything that you all want to talk further as far as schools,
well, one of the things that's been kind of set out, in the college level, I know people are more interested in the high school and grade school, but Indiana University is going to open with classes in the fall, and then they will go on to online classes in November. And then for the spring semester, they'll start out with online classes, and then as the semester progresses, they'll go back to live classes. So that may serve as a template in terms of opening and closing and whether or not it's live or online. As far as the actual physical situation in the classroom, I think we're going to have to, the virus is unforgiving in his rules. I mean, it's going to be distancing these children 6 feet. We need to, I'm sure masks they're going to be inside. One of the things that's problematic with little children is the fact that they're little children.
Yeah.
They want to go out on the playground and wrestle around and play with each other, and they want to, they want to push each other on the swing and on the slides, and it's going to be tough on these kids, and they're not going to have the school experience that we had. But I think it's going to be necessary to protect them. As Dr. Black said, these children are not in very grave danger of, even if they get coronavirus, of having a bad outcome. The problem, Eric, is the fact that they're going to be carriers. If one child gives it to another child, then obviously that child carries it home to his family. So it's more the problem of the child being a vector than fearing for the health and safety of the child himself. But this will all have to be worked out. The other side of the coin is, these children need to learn. They need to be back in the classroom. They need to learn their timetables and figure out where China is in relation to Europe on the geography map. So it'll all get sorted out.
Anything you want to throw into that?
Well, it's hard to follow Dr. Jetmore on that kind of thing. I agree completely that kids need to get back to school, and I think that the basic fundamentals of how to create a safe environment are already basically known. There's going to be distancing, masking, sanitizing. But some activities are not going to be able to carry it out as they might have been done in the past. That's just the way it is for a while until either COVID goes away completely, or we've got a good vaccine, or something else changes. If things continue as they are, that's what we have to plan for. But I'm always impressed by the resilience of people. I think we'll catch back up. I know I've seen some things in newspaper articles and in scientific communications about concern that every month of lost school time will have a certain amount of down the road negative impact on the life chances of a young person who are missing school. And I'm not sure we can really calculate that because people are so resilient. And, we're Americans. We figure out how to make the best of bad situations, and I'm pretty sure that the school administrators and teachers are going to figure out how to overcome all this really well.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We are speaking with Dr. Thomas Huth, Reed Health, Dr. David Jetmore, Wayne County Health Department. You can send us a question through our Facebook page or send us a tweet to @WCTV-info. Let's get to a question, and then as we have in the past, Dr. Huth has been able to provide us with some additional information that we probably need to go through to keep the community up on what's happening with Reed Health. And also there's a new website that he's going to take us to also and take us through. So let's get this question in. What about antibody testing? Where can I get it?
Well, some test sites are actually including it in their testing profile. There are a couple places in Ohio I know that you can go, that can be gone to. If you're an Ohio resident, that's the key thing. Most of the states are requiring you at least to be a resident of the state that you're going to be tested in. They are not doing it at the Optum site at the old Elder Beerman store that I know of. That wasn't in their plan. They're not currently doing that. On the other hand, at Reed, we have just been able to implement actually 2 different analyzers that are able to do antibody testing, and that's all been validated and appears to be performing very well. And so just like yesterday, we're making that available for order by doctors. And we have We were concerned that we would have very limited testing capability to start with that, but it turns out that we've actually got a lot of access to testing capability. So in effect, it's as available as any other test at Reed. And so really, as it stands today, to get a test at Reed, all people need to have is a valid doctor's order, and we're not placing any other requirements over and above that on it. So, you know, I think for somebody out in the audience who's wondering, you know, I was sick a month ago, you know, could that have been COVID? Really, the person to talk to is your own doctor, and maybe see if the doctor feels that it's justified to have the test, and he can order it, and you can get a test result on that. The bigger question is, how do we interpret those test results? And that's really where the conversation is today. What do the test results mean? And at the most basic level, it appears that virtually all of the different companies offering testing, all of their tests are actually very, very high-performing tests. Just saw on today's Indiana State Department of Health provider webcast at noon, the Chief Medical Officer, Dr. Weaver, mentioned that they feel that all the tests that are being used regionally actually are very high-performing, have very, very high sensitivity and specificity, which means very low false positives, very low false negatives, and that there does not appear to be much, if any, cross-reactivity with other coronaviruses. The importance of that is this virus that causes COVID-19 is just one of dozens or hundreds of coronaviruses in that family. And, you know, there has been concern, well, if we do an antibody test, could that actually pick up one of these other coronaviruses that cause common colds that we've pretty much all been exposed to? That turns out probably not to be the case. So if you have a positive test result, that means you have been exposed almost certainly. The question really is that I think most people want to know is, does that mean I'm immune from the disease in the future? And we don't know that for sure right now, unfortunately. I think it's going to take more scientific study to figure that out. So it's a stay tuned issue. What I'm advising people is that if you get the antibody test, you should always consult your own doctor about what that test means for you. Because if it's positive and I had a compatible clinical illness a few weeks ago or a month ago, it probably needs to be at least 2 weeks since the symptoms for the test to be accurate. But if I had a clinical syndrome that was compatible and I've got positive antibodies now, that raises the probability that that illness was COVID-19. But that's probably about as much as we can say. It's hard to say what that means for the future for any individual right now.
So just to summarize for the person that asked that question, if you want an antibody test, you can get it now, have your doctor order it from Reed, and the test is very high quality.
Mm-hmm.
Talk, if you would, and we mentioned it real briefly last week, and it had been a couple of weeks since we had, you're talking about testing and figuring some things out, COVID-19 plasma donor program at
Right.
Reed. Kind of mentioned that. Can you tell us where that stands? Are you all still trying to get people in? What are the expectations?
We are doing that. We have staff members actually who are dedicated to that project. And just as a quick background reminder of the process there, we aren't able to actually draw the blood and prepare the plasma here. That requires special equipment. So we have a partnership with the Community Blood Center in Dayton to do that service. But we are trying to find people who would be donors for that program, because we think that providing convalescent plasma to really sick patients can help. And there's actually beginning to be more scientific evidence that that's probably the case. So, and that's one area where having the antibody test actually helps. It's a requirement of the donor plasma registry that you have to have either had a positive PCR test, nasal swab test in the past, or have positive antibodies now in order to be qualified as a donor. So that is active. We've got information on our website. Go to readhealth.org. There's a link at the very top to the coronavirus information page, which has a link to that website, Donate Plasma. and you can get information about how to register for it, how to find out if you are possibly a donor, and then our staff can help make all that happen. You know, we're not using that as frequently because our numbers are down, but we still want to make that available. The plasma from Dayton is on a first-come, first-served basis, so that means we can't designate plasma to here, but we do need to make more available so that it will be available to all.
A couple of things, if you don't mind me kind of jumping in on some things, Dr. Jetmore,
I don't
maybe you
mind
can
at
help us
all,
out
Eric,
with.
until I find out what it is.
Update us, if you would, on the COVID-19 testing site at the older Bierman building, what you're hearing. We had Commissioner Paust here Tuesday night, part of our election coverage. He mentioned that it sounded like the numbers were beginning to go up, be more in the 90s as opposed to the 40s a couple of weeks ago. And I'm not sure if you noticed it on your motorcycle ride in, and I've noticed it the last couple of days. There were COVID-19 testing kind of placards out in the parking lot here. Can you tell us what that's about?
Well, I saw that testing site too. I think we had talked about this a couple weeks ago. The state of Indiana is going to test 20,000 people in groups of 5,000, and this is a by invitation only test, and these names are chosen from property tax codes, voter registration codes, and the people, they've set up 68 testing sites, and out here at Ivy Tech is one of those sites, and that's why you saw that sign for the COVID-19 testing. People are invited to come out and to be tested. They'll do both the antibody and the viral swab test, and this is to get an idea of how much virus there is in the general population of Indiana. When they did the first run through, they found out that 1.7% of the people who came in had COVID, and 45% of those had no symptoms. They didn't know they had COVID. And another 11% by antibody testing had COVID in the past. So the penetration of the virus in the population of the state was 2.8%. Now we've got a number, and with this second test, we will be able to see if this number changes. Is it static or more, is there a greater penetrance of the virus? In some ways, you'd like to see that number go up because as an epidemiologist, you'd like to see herd immunity, which is variously quoted as 60 or 70% of the people having immunity. So that's why those signs are out there.
Okay.
I haven't been invited to be tested. Have you, Eric?
I have not.
Have you, Tom?
No.
Well, I'm sure the three of us feel really bummed about that. But as far as the Optum site at the old Elder Bierman, the numbers are going up. That was at about 40 people a day, and now it's up over 90, which is a good thing because, as you've heard me say before, I don't want to lose that testing site. If that site's not utilized, the state will simply move it to another town or county. One of the things I wanted to say, Eric, there's some confusion about the actual test at the Optum testing site at the old Elder Bierman store. Initially, when they were doing the test, they were doing a swab that went deep into the nose, back to the nasopharynx, the very back of the nose. And then at about mid-May, they changed that to swab just the front of the nose. The reason they did that is it's more comfortable, and it's been shown that there's no difference in the results from where the swab is taken. But that's caused some confusion because some people went there and said, well, wait a minute, they didn't go clear to the back of my nose. Maybe I didn't get a good enough sample. Maybe they didn't, maybe my negative doesn't mean anything. Well, I'm telling this saying this to reassure people that either site gives adequate results. The other thing I wanted to say, and a lot of people don't know this, is you can go to the testing site after 48 hours have passed and be retested. You know, when you're tested for COVID, it's a snapshot.
Right.
It's, you know, at that hour, minute, day, you do not have COVID. But you may, 2 or 3 days later, feel like, my gosh, I think I've been exposed. I'd like to be tested again. Well, you can be tested again. 48 hours has to pass. You can use the same patient number that you did when you were initially tested. So I wanted to pass that along to people.
Nice, good information. Dr. David Jetmore, Wayne County Health Department, Dr. Thomas Huth, Reed Health. This is Ask the Doctors on Whitewater Community Television's WGTV Channel 11, streaming on Facebook Live, also on WCTV Channel 21. One of the things that you were bringing to us and have been bringing to us, updated numbers on patients in Reed, and also you had a site that you wanted us to see from Johns Hopkins. Why don't we start with some of the numbers that are currently at Reed? That way the community is up to date on where their local hospital stands with patients. So if Ryan or Steve, I'm not sure who's spinning the dials out there, has the...
We could start here, that's fine.
We'll start with Johns Hopkins. Johns Hopkins.
You know, I monitor all kinds of information and dashboards on a daily basis. This is one I check religiously. This is the that I think everybody ought to look at. It's interesting. There's a wealth of information on it. I won't go through it all, but there were a couple points I like to make from it. But just for background, this is an ARCGIS, ARCGIS dashboard that Johns Hopkins University maintains, and it's just reporting data. There's no editorial content. It's not massaged in any way. We can see up in the upper left-hand corner, at this moment, there are about 6.7 million cases worldwide and 392,000 deaths. That's over towards the right side. Down towards the lower right, we have it selected for daily case counts over time, and we can see, Ryan, if you might be able to enlarge that, might make it more plain, we can see that across the whole world, cases are actually still increasing. We were in a sort of a plateau for a bit, but in the last few weeks they've been increasing. And you can see that very clearly there on the right-hand side. If you go back, Ryan, now the question is, where are these increases coming from? You would think with the U.S. having the most cases in the whole world, you might need to scroll that up to the very top, Ryan, to be able to select for the U.S., because it's the top one. The U.S. is about 1.4 million cases, going from memory. I'm probably wrong there. What does that say? If we select the U.S., 1.8 million cases, but then we look back at the lower right-hand graph. I'm giving Ryan a workout running all over this thing. You can see that the U.S. cases are declining. So how is it that the country that has the most cases, and that's declining, how is it that the rest of the world is increasing? Well, the answer is, and you don't really find this discussed much in the news and the sort of non-medical literature, or even in the medical literature, it's other parts of the world, obviously. And if you go back, Ryan, I can highlight for you where those parts of the world are. In particular, it's Central, South America, also India, and some countries in the Middle East. And you can see that Brazil is right under the U.S. And if you select Brazil, you can see that their graph is on a sharp upswing. And virtually all of the countries in South America are on the same trajectory. And of course, if you add up all the population in South America, it's a lot of people. Then also partly down the graph there is India, down the scale, maybe about 4 more or 5 more down. You went a little bit too far. India has a very similar looking pattern, and India is important because that is one of the most populous countries on the planet. And of course, they're having a huge upswing currently now. So it's really Central South America, and that includes Mexico, India, and there's some countries in the Middle East. Won't go through all of that, but there is one country I love to highlight because I think it's a kind of a wonder, and that's Taiwan, which is way down the list in the 400s. So Ryan's finding that there. You know, Taiwan's a tiny little island off the coast of China. They're ethnically Chinese, but it's not communist China. They consider themselves the real China, the Taiwanese do. And in land mass, in area, it's about a third the land area of the state of New York, but it's got 20% more people, higher population than the whole state of New York. Wow. And we know that New York has been severely affected. Mm-hmm. Nevertheless, here's Taiwan with more people than the entire state of New York and very near to the original epicenter of the pandemic, China, only 443 cases and only 7 deaths. And it just happens that in the upper right-hand corner, New York happens to be naturally there. You can see that there's about 30,000 deaths in New York to this date. How is it that a country that's actually more populous than the state of New York, and it's in Asia where that was the original epicenter, how is it that they've escaped much disease? The answer is they did a lot of things, and there's a number of scientific publications coming out lately, and I've been circulating those to people that list all the things that they did. But the really key factor is they're a highly mask-wearing society. I think that much is becoming clear. There was a very recent publication looking at the different factors, doing statistical analysis on the different interventions that they made, and one of the ones that had the most impact was the mask wearing. So that's why I like to highlight Taiwan, because they are much more accepting as a society of wearing masks in public, as we're trying to get people to be more cognizant of now. They don't mandate it. It's all voluntary. They did not go into lockdown like we did. They did control the borders very early on, and that could have been a mistake here, not doing that as stringently and soon enough, possibly. But probably the border control, a lot easier to do on a tiny island, and the mask wearing appear to be the key factors to their success. So that segues into mask wearing. I did send over to Ryan something I would like the viewers to see. It's a little excerpt from a very recently published paper in the scientific literature on masks.
You'll have to talk to us about that. He was not able to get that one prepped for this, but tell us, keep talking.
Okay.
It's okay.
All right, well, it basically is a very good background. It's in the journal called Science. I think their website is sciencemag.org, and you can go look up the article, anybody can. And it overviews the whole theory and the science that's behind mask wearing. And it's got a very interesting graphic, a diagram at the back page that, towards the back page, I think it's on the second to last page of the article, that kind of visually displays what the concept is behind mask wearing, and basically helps to get the idea that if someone's infected and they're not wearing a mask, the person who's at most high risk is a well person who's also not wearing a mask. And if someone is infected, but someone else who's not infected is wearing a mask, they're at lower risk. And conversely, if someone's infected and they are wearing a mask, even if they're asymptomatic, and someone else who's not infected is also wearing a mask, that's the lowest risk situation for the well person. So I encourage people to go look that up and kind of review that. There is a certain amount of technical language in the article, but I think most people can probably get the gist of it. And here Ryan has got that, and he's showing the diagram that I was referring to, that the lowest risk situation, the minimum exposure, and the bottom part of the diagram is the person the well person who's wearing a mask, and that includes the infected asymptomatic person also wearing a mask. So we don't know if we have the infection unless we were tested today, got the result today, then we can probably be most assured. But none of us had that test today, so we can't say with 100% certainty that we're not shedding virus. That's why we wear a mask, and other people probably should wear a mask too to get maximum protection, if we're not distancing.
And we will actually see if our social media team can also maybe put that particular slide up on our social media site also, so it can be shared from there also. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, also available on CTV3 in Connorsville. We're speaking with Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health, Dr. David Jetmore, Wayne County Health Officer. You're just sitting over there quietly today. That's disturbing.
I'm having a lot of deep thoughts, though, Eric. I'm waiting to spring forth with them any moment.
If you have a question for the doctors, we still have a little bit of time left in this show. You can send your questions on our Facebook page, or you can send them via Twitter at WCTV Info. As people get out, now, something you said earlier, and since we're on the conversation of masks and being able to do that, one of the things that I think I heard you say earlier was that wearing masks outside is not as important, but I think you may have included you need to be social distancing.
Yeah, you still should social distance when you're outside, and you're going to encounter a lot of people outside now because we're going to be outside. The weather's warm, we want to be outside. I think, for instance, if you're outside and you're talking with somebody, I mean just talking is more likely to carry viral particles in the air toward the person you're talking to. And the other thing is, when you talk to somebody, you engage somebody, your natural human tendency is to get closer to them. You have to be very conscious of these guidelines. I still haven't extinguished the urge to shake hands. It's almost gone, and that may never come back. You know, one of the things when this first started, the CDC said nobody should wear masks, that it was a waste of time, and I parroted that idea. But the reason for that was there was so few masks, it's hard to ask somebody to wear a mask when they have no mask. Now we know that almost anything, any kind of a barrier is superior to nothing at all. And on that same note, we've gone from having a paucity of masks to having a tremendous abundance of masks. So Wayne County secured many masks. In fact, we're giving these masks out to businesses that are reopening because we want them to keep their employees safe, and we want them to also protect the public that come in to shop at the various businesses. But this has been a problem for a lot of businesses starting up to find proper PPE. So if you're a small business owner out there, inquire at the Board of Health, and they'll line you up with some masks.
Talk a little bit, both of you, about the rapid pace at which, and you just talked about it weeks ago. I mean, we've been doing the show 7 weeks, 8 weeks. I don't even know anymore. It was not so much about masks. Then it became about masks and social distancing and what we know about the virus, what we don't know about the virus, what we know about it could be different 2 weeks from now than what we know today. Talk about the rapid change, how you all keep up, and how you expect the community to be able to keep up with the changes and what they need to know to keep themselves safe.
I know Tom is a prolific reader of the medical literature, and that's how you keep up, is as a physician, I think, some of the things that have changed, and then I'm sure Tom has a lot of thoughts on this as well, was, initially we were cautious of any surface. There were studies published on how long virus lasted on different surfaces. More recently, the CDC's come out and said, hand hygiene is important. Don't rub your eyes after touching a possible infected surface. But it's certainly not nearly as important as respiratory spread by the virus, which must happen in the overwhelming number of cases. So that's something that's changed. The whole face mask thing has changed. Also, the idea of a viral dose. Time's a factor. In other words, if one of us has coronavirus and we stop and talk, say I'm the infected person, you probably wouldn't get infected if we talked for maybe a half a minute or a minute, but if we talk for half an hour or an hour, that viral load builds up until it reaches an infective level and you become infected. So those are three things that come to mind thinking about the things that have changed over the past few months as we've learned more about the coronavirus. Go ahead, Tom. I'm sure you have more thoughts.
I have observed many times and thought about many times about how quickly things change on this subject. But really, this is a microcosm of how things change in medicine and science in general. It's just that in other contexts, the rate of change is so slow that most people aren't really aware of the changes. But Dr. Jetmore and I have been in medicine long enough. I've been in a little over 35 years in medicine, and I've seen things swing from one opposite end of the spectrum to the other on different topics. Like, if you're a younger doctor today, you hardly know about digoxin, but there was a time where we gave digoxin to every heart patient kind of regardless, or other things that we used to do that we don't do now. Things change in medicine and science as more information becomes available, and smart people put their minds together to figure out what the new data means. The thing with coronavirus is that pace of changes happens so fast. That's why I talk about coronavirus years. Things that were true, that were taken as givens a month ago are, some things have drastically changed, and I call that the coronavirus years effect. It's a little bit like dog years, but in coronavirus years, a month ago was several lifetimes ago, and we can't count on things that we thought were true then still apparently being true today. And masking is one of those that has changed dramatically. But the reason it's changed is because people are now thinking about the fact that how has Taiwan gotten to be so good today? And they've looked into it and come up with those conclusions, or they've actually looked at the efficacy of masks and realized that it isn't all about the filtration efficiency alone of the particle size filtering capability. There are other factors in there. Thinking about change, many people in the very beginning were all excited about hydroxychloroquine, and we used quite a bit of it on our patients. But then there began to be data that, maybe it either wasn't helpful or could actually be harmful for some people. That pendulum may actually start swinging in the opposite direction again. We went away from hydroxychloroquine because of those kinds of concerns. But just yesterday or today, the Lancet, which is a very super highly respected medical journal, has retracted the landmark article that was a big 15,000 patient study of the risks and benefits of hydroxychloroquine, and that was very negative, which basically caused everybody to stop using it routinely. They've retracted that article today. This was an article that was just published like 3 weeks ago, which is at least one lifetime ago in coronavirus years. Today, the reality is different. But these kinds of changes are happening so quickly. They happen in medicine normally. We just aren't aware of the changes because they happen so slowly. We may go back to hydroxychloroquine. I don't know.
We've got time. We are about 8 minutes left. We've got a couple of questions that have come in, so we'll get to these. Let's get the first one up. Are there any studies that show any effects on individuals who wear masks for a long period of time? I know there was conversation that wearing a mask might not be healthy. So,
Well, I'm not aware of, well, as a person that's worn a mask for long periods of time, up to 6 hours over a period of 40 years, I'm not aware of any ill effects. It will make your beard white if you wear it long enough, Eric. But other than that, no, I'm being facetious.
that and worrying about when my barber was going to
think that
reopen
was
were two
a
things that,
different- a different time problem, not the mask wearing time. It was
The 40 years that caused the beard
That's
to
right.
get white, not the mask. But I don't think, if you're wearing what is it, N19?
N95.
N95 mask. I mean, it's hard. I've got an N95 mask, and it's hard to get enough air if you're physically doing something. You have to cheat and go for a breath of air when you're in the grocery store if you're wearing an N95 mask. But I'm not aware of any ill effects on a person's physical health from wearing a mask. Are you, Tom?
No, not really. I think there may be some theoretic concerns on a couple of points, but theoretically, if you're wearing a homemade cloth mask and you're not keeping it clean, maybe it becomes a reservoir for bacteria and so forth, possibly. But I think that's a minor issue. When we talk about the surgical masks, I was going to ask you, Dave, and you already referred to it, there are plenty and plenty of doctors and nurses who go into operating rooms and other scenarios where they have to wear a mask for hours and hours and hours all day long, 8, 12, 15, 17 hours if you're a back surgeon doing a highly complex surgery. And I am not aware of that being having long-term negative consequences. That has never been reported to my knowledge. So I know that people have those concerns, that it's out there kind of in the general hum of things that wearing masks is harmful to people. That's probably not true. Now, having said that, there can be minor inconveniences that people experience. If I'm trying to do something, if I'm wearing a mask, I'm trying to do something that's exertional, or even just trying to have a long talk, it can feel like I'm feeling a little breathless. I've got to take it off to do this. And I would say that there are probably some people who can't or shouldn't because they have an underlying health condition where maybe their breathing is affected anyway. And somebody with bad lung disease from one sort or another might feel that they have more trouble wearing a mask. So with those outlier situations accounted for, the average person is really not going to have a negative impact from wearing a mask.
okay.
So keep wearing your mask.
Keep wearing your
everyone.
masks. We've got about 5 minutes. Want to try to get one more in. And if we don't get to your question, we'll start out with it next week. Can you get vaccinations at a pharmacy? Government prohibited, or is it up to the pharmacy?
Oh, I think a lot of pharmacies do vaccinations, particularly like in the fall for flu vaccines. They frequently do those. There may be some other vaccines that they're doing. It really boils down to what each state's pharmacy board and legislature, what the rules and regs allow them to administer and under what conditions. And pretty much every legislative session, there is a new set of requests from the pharmacy industry about things that they want to do, be able to administer in pharmacies, and some are granted, some are not. But I think that they can do vaccinations as a general concept. The question is, which ones are they allowed to do? And those decisions are impacted partly by, what's safe to administer without a medical professional like a doctor or nurse present, or there can be, other maybe even economic considerations that factor into it. But there's a lot of things that the legislature considers in that. But you can get your flu vaccine at most every pharmacy. I'm not aware of any that don't administer them. And I think when and if we get a COVID vaccine, that's one that there'll be a lot of impetus to make available in as many venues as possible, and I'm certain pharmacies will be doing that.
You know, speaking of immunizations in general, which are, of course, very important, I mean, that's kind of one of the backbones of public health. You can get vaccinations at your family doctor, but your family doctor may not offer vaccinations because these vaccines are expensive. They have to be stored in a refrigerator, in some cases in a freezer. That refrigerator and freezer has to be backed up with a generator because if the power goes out, all of that vaccine is lost. So I think one of the things people should always think about is the local health department, where you can get your vaccinations. So I just wanted to add that thought to Tom's.
Yeah.
And if you're not familiar with it, the health department did move. It's been recently, a month or 6 weeks ago, maybe. Health department moved, corner of South 5th and A Streets, right across from Fire Station 1 is where the Wayne County Health Department is. We're going to end it there for this week, gentlemen, since we are down to about 2 minutes or so left to go in the program. Dr. David Jetmore, Wayne County Health Officer, motorcycle rider, white beard guy. Have yourself a great week. Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health, and also still Wednesday evenings at 5 p.m.
That's right.
WHIO's
They haven't
newscast.
fired me yet.
Huh?
They haven't fired me yet.
Haven't fired him yet. So if you want to hear more from Dr. Huth, Wednesday evenings, 5 p.m., WHIO TV. He provides some additional medical information. Gentlemen, as always, appreciate you taking some time out of your day to come and answer community questions.
Pleasure.
Thanks for having us, Eric.
I want to remind you that the free COVID testing site is still open. Encourage you to go 8 a.m. to 8 p.m., 601 East Main Street. That's the old Elder Bierman building. LHI Care /COVID testing. They would like you to register. They will take walk-ins, but they would like you to register. Also want to remind you to do some physical distancing. Everybody's getting out. If you're going to be out and about, public parks, trails, wear a mask. Don't use parks and trails if you're experiencing symptoms. Be prepared for less water fountains and public restroom access. That is one of the things about this coronavirus outbreak. As people are trying to get around and not a lot of places are open, there are less public restroom access. If you are in need of food help, there are a couple of ways to get that out. Centerville Abington Schools, Bulldogs Helping Bulldogs. Their food distribution is Wednesday from 5 to 6 p.m. Richmond Community Schools has daily grab and go meals. And also Western Wayne Schools has breakfast and lunch. Meals will continue to be available for all students K through 12. And the Richmond Farmers Market is open every Saturday from 8 a.m. to 12 p.m. at Jack Elstro Plaza in Richmond. Thank you very much for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11. You can see replays of this on our YouTube page as well as on Channel 11. Have a great weekend. I wish you well.